Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to be talking about Bella Hadid again. Because she just came out with an article recently in Vanity Fair.
No, Vogue. I sent you a Vanity Fair article, but it was in Vogue.
Mother's crikeys.
She talked. She talked to someone.
Okay. Do I have to go through that whole thing over
No,
now?
no, it's fine. Keep going.
But right there it says Vanity. Whatever.
I think it was with Vogue. Anyways, continue.
Oh, okay. She recently, in an article, admitted to having plastic surgery. She admitted, and she also says sort of regrets having had a rhinoplasty at age 14. And I don't want to say I told you so, but I told you so. But I think that, you know, overall, she said she had wished she kind of kept her nose because she wanted the nose of her ancestors, and she regrets getting it a little bit overdone. And I do want to say, overall, I do think Bella's beautiful. There's no doubt about that, right? And I can only imagine the pressure of being constantly photographed and all over the place and on magazines and runways. And so that's why I warn people, don't fall prey to the social pressure and don't try to overdo these surgeries, because sometimes you can regret it. And I tell them to go conservatively because you can always do more, but sometimes it's hard to put it back. Like I said, originally with her nose, I think it was overdone. And maybe if she hadn't overdone it, she wouldn't have regretted it at this point as much. One of the things that I want to comment about looking at her nose, because I'm not just trying to say, oh, you know, she admits to having rhinoplasty, is what could she do? You know, now she's here, she had it overdone, and she's regretting having done it. Could she put it back? You know, and although I said it's difficult, I think it is possible for her to rebuild some of that nose. Now, it wouldn't be a super simple surgery, but she could. There are things to do to rebuild the bridge of her nose. She could borrow grafts from her rib, and she can rebuild the bridge of the nose. She could rebuild the tip of the nose, similarly with rib or with a little graft from her ear. They would be longer surgeries and slightly more complicated with some healing time. But if she wanted to reverse some of those things, it is possible. So it is something that, I warn people not to overdo it because it's complicated to fix it. But it is still somewhat fixable in her case if she really wanted to do it. One other thing I wanted to say about Bella is what she's sort of even more famous for are her cat eyes, or the pulled look to the corner of her eyes. And in the article, she's saying it's due to face tape, that she said it's the oldest trick in the book. I just use tape and it pulls the corner of my eyes up. And I have to say, I do know a lot of celebrities that admit to this and, you know, come to the office and they do this sort of taping and pulling, and this sort of pull is also meant to mimic what's a tight ponytail or pull up on the side, or what's called a ponytail lift. But can face tape really do that? That's really the question. And in her case, it might be possible. I think that you know, I see some pictures of here where they're not quite as pulled, and other pictures a little more pulled. The things that make me a little more suspicious that it's not just tape is how is she hiding it so well in all of these photos, all of these runways. Her hair's pulled back. There's nowhere really to hide the tape. If the hair's down, you can hide the tape. There's other things you can do with it, you know, but maybe she's a total master of this technique. I will say there's other things that she can do and other people do. Like I said, in some of those pictures, her ponytail's pulled really tight. That can actually pull the eyes up with it. Could there be a little tape? Possibly. And then there's the other things, brow reshaping, there's makeup. All these sorts of things can help to give that illusion of a more pulled eye. And maybe she has somewhat of a pulled eye and then accentuates this with these other things. So it could really go either way, but I will say, if it comes out that it really is due to tape, I have a feeling that there's going to be an upcoming shortage of this tape available online because everybody's going to be running out trying to tape their eyes up. So I think it's going to be interesting to see what comes out of it, but I think it is possible, but she has to be a complete master at it if it is just from tape.
It's pretty hard for me to believe that it's just tape. One thing that I do notice about Bella, though, is she definitely does her makeup, or her makeup artist does her makeup in a way that accentuates her eyes. Yeah. So I think we do see a lot of that. Like, I think people sometimes also, I know we hear a lot in the practice, like Ariana Grande also kind of is known for her eye shape, and I think with both of them, yes, they have these eyes and maybe they're augmented, but it's not just the augmentation that created that look or that illusion. Now with Bella, I think it is a little more interesting because there are photos of her, like I know I sent you one, where she doesn't appear to have very much makeup on, and that's what made me like so suspicious, because I'm like...
And her eyes still pulled up.
Yeah, so it's like, so you put tape on, but you didn't do anything else that day?
That's why I'm saying that's a little suspicious. But then the other question is, if she admits to having her nose done, why doesn't she just admit that she had that surgery? I mean, it seems like if you're already admitting and coming out and saying, hey, yeah, I did have a rhinoplasty, why wouldn't you say I also had a brow lift? I don't know why you wouldn't say that, or cat eye lateral brow lift. You know, like I said, when I'm looking at her photos, I do notice when she has those tight ponytails, the lateral brows are more pulled, and then in certain pictures where the makeup's really accentuated, it looks extremely exaggerated. Is it possible in some of the other photos she's using tape, some of the other photos she's using makeup? It's possible. And I think in her it's pretty, you know, it's not, sometimes it looks overdone, but that's the times when she's really pulling it. So maybe she did have a slight bit of it. The other thing I noticed is that when we're looking at her hair pulled back in a ponytail, I don't also notice a scar or anything in her hairline from a lateral brow lift, you know, unless it was a very minimal incision with an endoscopic, or where they use cameras and it's a very minor, or it's threading, or some shaping with threading, Botox, and other things. It could be just that, or it could be taping, but like I said, she has to be really good at hiding that tape somehow.
Another thing that I want to talk about is that she said she's had absolutely no Botox or filler.
Well, like we always say, you know, when you look at her, one thing I will say about that, if we look at her lips when she was younger, they're definitely not as full as they are now. And like we say, lips don't just get fuller as we age. In fact, they get thinner. So I am very suspicious about at least lip filler. And probably, how old is she? I mean, she may be doing little touch-ups with fillers and Botox. And it could be just really amazing skincare as well. I mean, she has access to all those things, amazing makeup artists and skincare and other things. So, you know, I don't ever want to judge a book by its cover. Some of these things, she started out beautiful and she just, you know, maybe she's doing everything right. Now she's admitted to the nose. And I don't see why, on the other hand, why she wouldn't admit to doing the other things if she's already admitted to the one surgery.
Last question is, Bella obviously had the rhinoplasty when she was 14 and she's had a pretty extreme result. I think one of the biggest takeaways with her is that she has kind of no bridge to her nose, and that's what makes it seem so obvious. To clarify, it is possible for someone to have a quote ethnic rhinoplasty without totally taking away all of their ethnicity and totally reshaping the nose.
Yeah, of course. You know, there's finesse rhinoplasties, minimally invasive ones where you're doing just certain things. You can leave a bump on the nose, you can leave the tip big, you can leave certain features. I have patients all the time requesting, I just want to touch this up but leave this one alone. And again, that's why I'm a fan of the closed technique, because I can target certain areas without disrupting other areas. Whereas when they open, you're pretty much dismantling the entire nose. Again, in her case, you know, the advice would have been don't overdo it. Do a little bit less on the nose, and then you can always do more. And whether she only had one, that's another question. If she only had one rhinoplasty or multiple rhinoplasties. But if it was one, it was done very aggressively. So yeah, they really, like we talked before, the inverted V deformity, and really brought down the bridge too much. And so, and like I said, it's possible for her to rebuild that to a certain extent, but the better option would have been not to overdo it in the first place.
Cool. That's it.
Yay, and the pinch tip and everything else.